This is Mardy Chizek with Charism Home Care and Eldercare Services. We're here at the office at 4905 Main Street in Downers Grove, and I have a guest with me this morning. This is the video blog that we do and post to our YouTube account, so please take a look and follow us. I have Mary Jensen, who is a dental hygienist, with me this morning.
Correct.
Thank you, Mary, for coming to visit.
Thank you for having me, Mardy.
And Mary and I are going to talk about a topic that I think we often forget. We don't do a particularly good job of managing oral health and oral hygiene. It really is a hygiene issue, isn't it?
Absolutely.
For seniors.
Yes.
Whether that's at home, whether it's an institutional setting. And so tell me a little bit about what happens if we don't do good oral hygiene.
Okay. Well, the first thing I think people should be aware of is that gum disease is the most prevalent type of inflammatory disease that the body can have. And so statistics show that anywhere from 60 to 75% of adults have gum disease. So we know it's out there. And then if you add that into other issues that seniors might be, dealing with, it can make oral hygiene very difficult. So what are the consequences of poor oral hygiene? That inflammation that's happening with the gum tissues.
Now, you talk about inflammation. Is that different than infection?
It can be used interchangeably.
Okay.
But when I speak of inflammation of the gums, I speak of bacteria that's been on the teeth too long, and the gum tissue responds to that. The gum tissue say, hey, I don't like this. I don't like this bacteria here. It's irritating me, and the gums become red, swollen, they bleed easy. So you think, okay, well, what's the problem with that, It's a huge problem, because any areas in your body that have inflammation, it's going to affect all the other areas of your body. The mouth's connected to the body. Many times people think, oh, it's just brushing your teeth, but medicine doesn't really start in the back of the throat, it starts in the mouth. So the consequence of having poor oral hygiene, especially for our seniors, is that it can compromise or exacerbate other health issues that they might have.
Okay, so how should we, we're taught to brush our teeth from the time we get the baby teeth at,
right.
18 months, 2 years?
Right.
What happens?
Well, I think sometimes there can be maybe a lack of very thorough home care. So that would be the first step, is to make sure that the individual is having their teeth brushed at least twice a day, preferably in the morning and then before going to bed at night. And some sort of interproximal cleaning, whether it's with floss to get in between the teeth, there are little brushes, there are little go-between brushes, something to help get that bacteria out from in between the teeth. It's so important. And then certainly if they have other issues, such as maybe a dry mouth, or if you want to incorporate any other kind of rinse, those are available as well.
Okay, and so what's the importance with, what was the term you used to use the floss?
Oh, to clean in between the teeth? Is that what you mean?
Yeah.
Interproximal?
Interproximal.
Okay, bacteria build up in between the teeth as well. So if you're just brushing, 50% of your teeth are still dirty. It's that in-between surface that you need to keep clean as well, at the gum line and below the gum line, and that's what the floss will do.
Okay, and so what is the issue with dry mouth?
Dry mouth, there are probably 400 different medications on the market that a side effect of the medication is dry mouth. And so if an individual has dry mouth, one, it can make it much more difficult for them to eat and chew their food, which we know is one of life's greatest joys, is eating. And it will increase their cavity rate, at the rate that they get cavities. You can think of saliva as nature's miracle. It cleans the mouth, it cleanses the mouth naturally, it helps to digest our food, it helps us to eat, it helps us to speak. If you have a dry mouth due to the medication, you can count on having all of those things be much more difficult, as well as an increased rate of getting cavities. So that's just another component that adds on to our seniors and the problems that they can have with maintaining their oral health.
And how do I know if a senior, let's say a senior has dementia, and so they're not able to talk to me, they're not able to tell me
that they
feel.
That they have dry mouth?
How do I know?
Well, I would be able to do an assessment for that, and I can look in immediately, and I'll notice that if a mirror or if my gloved hand kind of sticks to the lining, the inside lining of the mouth, inside the cheek, That mouth is dry. That mouth is
But
dry.
what's many of the people that are going to be watching this are not necessarily
Right.
going to be able to have you come into their
Right,
home.
right.
So how do I, as a caregiver, if I'm helping take care of my mom in my home, how do I know?
Watch maybe how they're eating, and if it's taking them longer to chew their food because they're trying to get more moisture in their mouth to kind of swallow that ball of food. You can watch that, or simply ask. I know sometimes, obviously, if there's dementia there, they might not really be understanding that question, but just give it a try. They might be able to give you some sort of information on that.
Good.
Yeah.
So what we talked about this morning, briefly, was dry mouth, oral care, and how important it is to have that be a complete process for seniors and a consistent one.
Absolutely.
And we will be back with Mary for further discussion. Thanks for stopping by. This is Mardy Chizek and Mary Jensen. We are at the offices of Charism Home Care and Eldercare Services. Thanks for stopping by. We'll see you again soon. Bye.